Hi everyone, today I will be presenting about NG tube feeding. This is the important nursing skill used for patients who cannot take food orally. I will explain the indications, procedure, complications and nursing responsibilities. Then I will discuss about introduction. NG tube feeding means giving nutrition through a tube inserted from the nose into the stomach. It is commonly used in hospitals, ICUs and long-term care settings. It helps patients who cannot eat by mouth but still have a working digestive system. Then I will discuss about indications. NG tube feeding is used for several conditions. For example, patients with stroke often have difficulty to swallow it. Unconscious or semi-conscious patients cannot eat orally. It is also used for malnutrition, severe illness or trauma to the face or mouth. Generally, it is used for short-term feeding less than 6 weeks. Contraindications. There are some situations where NG tube feeding is not safe. For example, severe facial trauma, esophageal varices, basal skull fractures or GI obstructions. In these cases, inserting a tube can be dangerous. So, other feeding methods are considered. Then I will discuss about equipment needed. These are the items required for NG tube feeding. NG tube, syringes, stethoscope, lubricant, pH strips, feeding formula, gloves and tape. As a nurse, always prepare your equipment before starting the procedure. Then I will discuss about how NG tube inserting. Before starting, explain the procedure to the patient. Measure the tube using NEX method. N means nose, E means ear, X means civic sternum. Nose to ear to civic sternum. Lubricate the tube with an insert through the nostrils while the patient flexes their neck. If the patient is conscious, ask them to swallow water to help insertion. After reaching the correct length, confirm placement using gastric aspirate, pH testing or X-ray. Finally, secure the tube with tape. Then I will discuss about types of feeding. There are several feeding methods. Bolus feeding is given in larger amounts at intervals. Intermittent feeding is given several times a day in smaller portions. Continuous feeding uses a pump and runs slowly over hours. Cyclic feeding is usually given at night. The method depends on the patient's condition. NG tube feeding procedure. Before feeding, always check the tube placement. Assess the residual volume. If it is more than 150 ml, hold the feed. Keep the patient upright at 30 to 45 degrees to reduce aspiration risk. Use formula at room temperature and feed slowly. After feeding, flush the tube with 30 ml of water to prevent blockage. Document the amount given, time and patient tolerance. Then I will discuss about complications. Some complications may occur. Aspiration is the most serious, where feed enters the lungs. Other complications include tube displacement, diarrhea, constipation, nausea, vomiting or blocked tube. Nasal irritation and electrolyte imbalance can also happen. Then I will discuss about prevention of complication. To prevent complications, always check placement before each feed. Keep the patient upright during feeding and for at least 30 minutes afterward. Monitor the feeding rate and flush the tube regularly. Observe bowel habits and maintain nasal hygiene. Proper nursing care helps prevent most issues. Then I will discuss about nursing responsibilities during NG tube feeding and insertion. Nursing play a vital role in NG feeding care. We must verify placement, monitor vitals and check for aspiration signs, maintain tube patency, providing mouth and nasal care and giving the correct feed at the right time are essential tasks. We also document everything accurately. Thank you for watching.